Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for joining us. One of the first questions that I wanted to talk about, well, yesterday our second set of vaccine from Russia came, and I wanted to know basically how was it logistic-wise, if it was difficult or challenging given that other countries are still trying to access vaccines as well. I know this is in keeping with a promise made by the President, and how much does this strengthen our arsenal against the coronavirus?
Well, that's a very long question. We are happy to get the second tranche of the Sputnik vaccine. As you know, Guyana has bought 200,000 doses of the Sputnik vaccine. We had the first 25,000 that came, and now we have the second tranche of 30,000. And later in the week, we are expecting some additional vaccines. These vaccines are very important for us to roll out to immunize our population, and that is why we are paying so much attention to making sure that we get vaccines into Guyana and that we vaccinate as many people as possible. Our vaccination program has been going quite well. So far we have done 63,740 persons have received their first dose, and as of yesterday we had about 3,455 persons who received their vaccines. We are going to scale this up as our staff become more proficient in the use of these vaccines. We want to scale this up, and we have deployed to the different regions enough vaccines for them to use and to make sure that this program is ongoing.
All right. You basically covered almost everything I wanted to ask, but when are we likely to get our consignment from COVAX? But before you answer that, what has been the general response like from the other regions?
I think the response has been good. On the coastland, generally people are coming out, and with the assistance of many organizations who have been coming forward to collaborate with us, they have been able to go into the community, mobilize people, bring them out to the vaccination site, and that is quite a good thing. So because of that, we are seeing more people coming out to the sites and getting their vaccines. In the hinterland, as you can imagine, that sometimes can pose a challenge because of the geographical spread of some of the villages, and therefore, while we're working in different parts of the hinterland, it would take us some time before we can get to all those different villages and to be able to do the immunization. Nevertheless, we have trained teams of persons in these different regions so that they are able to, from a regional level, roll out this vaccination program.
All right, and as we're on the vaccine, you mentioned that we're to get additional vaccines this week. Would that be from COVAX, or are you able to say?
No, this is from the set that we have bought. We're expecting some more on Thursday. And in terms of the ones from COVAX, we have been told, and I was in a meeting yesterday with health ministers in the Caribbean, and we were told that we should expect additional vaccines through the COVAX mechanism sometime between now and May. There wasn't a definitive date, but we should be getting additional sets of vaccines before May from COVAX. How much, we don't know as yet, and when, we don't know as yet.
All right. We had gotten reports that there were talks of shortage in Region 3. Are you able to clarify that?
I'm not aware of that. Region 3, we have allocated enough vaccines for them. Sometimes one of the challenges that we encounter is that if the staff would have catered maybe for 300 person for this community, they probably would have taken 300 vaccines to work with on that given day. And if we get more people, having assessed the amount of persons that are coming, they would normally send back to collect additional vaccines. So it's not that it's short, it's how it's being allocated and accounted for, because these vaccines, one of the peculiarities of the vaccine is the cold storage. We have to store it at -18, -20, and then when we are ready to administer it, then we thaw it out and give the person. If you thaw the vaccine and then and you didn't use it and you try to put it back, that's not acceptable. You have to throw it away. So that's why we are very stringent with how we give the vaccines out, and for the staff who are using the vaccines to properly account for them.
All right. You mentioned cold storage. Now that we're getting these additional vaccines, earlier on we had spoken about private companies that were assisting in terms of the cold storage. How is that going?
Yes, we have created additional storage, and so we have built capacity in Region 4, Region 6, that would take care of 6 and 5. We have built capacity in Region 10. We are in the process of completing some additional capacities in Region 2. So they would have adequate cold storage. And this is different from the usual thing of 2 to 8. We now have to store at the -20. So we had to make some adjustments to be able to do that. But the cold storage is in place. That's not an issue right now.
Okay, great. I wanted to ask about the situation in Brazil. It has gotten worse, and basically what is being done to strengthen our own monitoring and response in those regions closer to Brazil?
Well, based on the reports that we were seeing for several months now, we have taken the additional precaution of closing the land border with Brazil and the air border. You would notice that from the various orders that we have issued. So there's no official communication between the two countries. We have increased the COBICOR patrols along the border. These are the joint services who are normally deployed there. So they have strengthened, they have been monitoring the border very actively to prevent persons who might want to go across or come across from Brazil. So as much as possible, that's what we're trying to do, prevent people from coming over or going over. That, of course, can be very challenging because of the extent of the land border, but as much as possible, that is what the joint services are right now trying to do. In terms of testing, we have PCR capability now at Lethem Hospital. So they have a gene expert machine. They're able to test locally. We have given them the cartridges to make sure that they're able to do that. And if they have samples that they still want to send to Georgetown, then we can take those samples and process the samples. So this is how we are monitoring. And as you know, the RHOs for the different regions would report on cases and on what is happening with the epidemic in their regions.
All right, just for a bit of clarity, I know earlier you had said that on Thursday they opened for the, economic activity must continue. That is still in place?
They have put additional stringent measures to minimize contact.
Okay, great. My last question I wanted to ask, I know we're in the vaccination stage, but as you just mentioned, testing is still ongoing. Have we seen any sort of change with the numbers in terms of testing?
Yes, we are doing more testing now, and with more testing, we're seeing more cases. So it's not only the government system that is testing. As you would recall, also, we have granted permission to a number of private institutions. Some of them have been licensed to do PCR testing. So you have 3 additional laboratories that are doing PCR testing, and you have probably about 8 or 10 that are now doing antigen testing. So our testing capacity has gone up tremendously, and because more people are coming forward to get tested, we are able to get a better picture of what is happening. So we do have, based on the amount of testing that we're doing, we're seeing a lot more cases, but this is based on the extensive testing that we are also doing.
Okay, great. Well, Minister, thank you so much for speaking with us. Well, that's it for today's COVID-19 update. We've just spoken to the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course our social media platforms.